Okay, nursing interventions. These should not be a surprise to you. They are very similar to the ones for coronary artery disease, correct? Teach diet modifications. Why do we need to do that? Because we know if we can stop the progression of coronary artery disease from developing, the progression of blockages from growing inside those arteries with diet, then we know we have less chance of having angina, right? So nothing shocking there. That is a nursing intervention, a big one. We do a lot of teaching. Exercise. Again, not a surprise here. Why we talked about exercise? One, because it's good for you. It helps to release that HDL, increase those HDL levels, right? Which could help to lower those LDL. But also, increasing exercise, our heart gets more fit, but it also increases collateral blood flow, right? So the more blood flow we get to the myocardium, then one area that it might be a little bit more blocked is not as detrimental than if we just have one area of blood supply. Okay, I know it kind of sounds goofy how I'm saying it, but collateral blood flow to the muscle means more oxygen getting to that muscle, less chance of angina happening because we have multiple routes of getting that blood to that particular area of muscle. Medication instruction. Okay, obviously we talked about that. They're taking a nitrate. Okay, they're taking nitroglycerin. So what do I want to know about nitroglycerin? What does your patient want to know? If the doctor said to you, you are prescribed nitroglycerin, so here you go. Do we just give you a bottle? No. One, what is the shelf life? Two, where should it be kept? How should it be kept? Okay. Should it stay in the bottle that it comes in? Should it be protected from light? What is the expiration date on that medication? Okay. Also, all of these are nursing interventions. In addition, how do I take it? Okay, so I'm feeling chest pain. When do I take it? Take it right away. If you're sure this is angina, go ahead, take a tablet and put it underneath your tongue. Okay, can I take it again? Well, sure you can. How long do I wait in between pills? How many times can I take it over a span of time? How many minutes in between? And at what point does it not go away that I go to the ER? Okay, so all of these instructions. So please, for me, because nitroglycerin is such a common medication that patients have at home, I want you to know about this drug. So look in your Brunner book, find out what it talks about when it talks about nitroglycerin, and also look in your Lilly book to learn about nitrates. Okay, so teach disease process, okay? So obviously this is management of this disease. They have coronary artery disease. So at some point in time, if they don't modify their diet and they don't exercise and they just continue down the path that they are and they continue to smoke, then they are going to have need some instruction on if their disease progresses and they develop angina. Okay, so please, your job as a nurse is always to manage this disease so it doesn't progress. You're always going to be teaching on this. Okay, so we have one last question. The question is, a patient with angina complains that the anginal pain is prolonged and severe and occurs at the same time each day, most often at rest and in the absence of precipitating factors. How would the nurse best describe this type of anginal pain? One, right off the bat, what I'm going to tell you is if you look here, here's your answers. If you look here, did I ever mention variant angina? I never mentioned that. So one, you can get that off there. Never heard of it. Professor Franks never said it, so I'm going to scratch it off. I never heard of non-anginal pain either. What is that? You either have it or you don't have it, and if you do, it's stable or unstable. So right away, you can get rid of this one and right around. Get rid of this one. So now we have stable and unstable to decide between. Well, now here's my information that was given to me. It says most often at rest in the absence of precipitating factors. So what did I tell you? With stable angina, they can get relaxed, or it can go away with rest. This is at rest. I still have it. And it's the precipitating factors there. So I didn't do anything and I still get it. So what do you think it is? It's unstable angina. So one, know the difference between the two, but also this is how you can look at a question and be able to decide which ones can I get rid of fairly quickly and not have to worry about, okay? Don't let things like this go, oh gosh, did she mention this and I don't know, and now you're racking your brain and now you're more stressed out. Don't. Get rid of it. Get rid of it. Focus on those two I mentioned, Dad. Okay? So I just want to thank you so much right now for allowing me to videotape these lectures. I know there was a lot of technical difficulties. I know that there were many videos I had to get to you. I apologize in advance. Please, I hope that I've gotten this to you in a timely manner, that you can generate questions if you need to. Get a hold of me, please, by email. I check my email all the time. And so, again, thank you for allowing me. And again, I apologize for not being there. Have a great weekend. Bye.